Hello everybody. Today I'm back at the wall of knowledge, the table of knowledge of sticky notes in my closet to talk about being pimped in front of patients, which is usually something that doesn't happen. Most of the time, pimping in the medical profession refers to an attending drilling a medical student or a resident, like in the operating room about anatomy or specific pathophys of diseases. But today I was pimped in front of a patient about LDL cholesterol levels, specifically in a patient who had a history of coronary artery disease. They were not type 2 diabetic, but the thing is, if a patient is a known vasculopath, i.e. they've had stroke, atherosclerosis of their coronary arteries, things like diabetes as well, and peripheral artery disease in their legs, you have to have a lower goal LDL cholesterol, preferably below 70, but oftentimes we shoot for 40 to 50, as low as you can go, honestly. And this patient had an LDL level of about 103, and in a normal person, that's not too bad. We really only get concerned once we get above the 190 range. So, me being an idiot, I was presenting to this attending, and for some reason he was having me do it in the room in front of the patient. And I said, I think their LDL level is currently a goal. Let's continue their, rosuvastatin dose as is. And he stopped and he said, "Is that really what you want to say to me?" And I stopped and I thought about it for a second, and I was like, oh my God. No, they should be below 70, and clearly he's already on the highest dose statin we can go. We need to counsel him about lifestyle changes. Stop eating red meat, cheese, fried foods, anything that has a lot of cholesterol in it. We need to try and eliminate that from his diet completely, because we treat type 2 diabetes, coronary artery disease, all these things. Even if you haven't had a heart attack, in terms of managing LDL levels, we treat them as if you've had a heart attack already. So we're trying to get that as low as possible for these patients. And because I was pimped on that, at least I'm going to remember now for the rest of my life the embarrassment of getting that wrong in front of the patient. But just wanted to share that story with you guys. Have a great rest of your day. Bye-bye.